Välkomna tillbaka. Mitt namn är Rickard Engberg och jag är aktieanalytiker här på Erik Bank med fokus på tech, där bland annat medicinsk simulering och medicinsk mjukvara ingår. Med mig har jag Göran Malmberg, vd på Mentice. Göran, välkommen.
Tack så mycket.
Göran, scenen är din.
Okej, så vi har beslutat att vi kör här på engelska, så hoppas det är okej. Thank you, Rickard. So I'm going to try to do a quick overview of Mentice and what we do. And we deal with image-guided interventional therapies, which is sort of in line with the theme for the day. So we can move to the next slide. And the disclaimer to the next slide, please. So I'm trying to explain the business a bit. As I say, we provide solutions for image-guided interventional therapies, also known as endovascular therapies. So everything related to the human vessel tree, really. All right, next slide, please. And another click. So our mission is really to move. We started back in some 20 years ago, more as a general training provider, simulation company provider. But our aim is to move more into the performance area and more look at providing solutions to help physicians and healthcare professionals to make better kind of decisions and really to improve efficiency and as I say here, eliminate proficiency barriers. So that's our high level mission. Next, please. So very short fact slide on Mentice. As I said, 20 years old, a little bit more. Gothenburg-based Swedish company, but very global. Very little part of our business in Sweden or even in the Nordic countries. We are established global and on a global base with 9 offices around the globe. 3 offices in the US. US is majority of our business, about half our business, but well distributed business across both Europe and the kind of APAC area. We are over 100 people, probably 110-ish people right now. We've been on the Stockholm exchange since 2019. Current market cap about $250 million or 2.2 billion SEK. We have over 500 hospital clients, university hospitals, teaching institutes, but also general hospitals. Also very well distributed across the globe. Over 1,500, I think we're approaching 2,000 systems sold since start. A lot of articles, material is written about Mentice, over 140 scientific articles or studies and similar. Patents is an important part of what we do and how to protect what we do for the future. So a growing patent portfolio. In our niche, we are a clear market leader. We're over 50% market share. In many, several parts of our business, I would say we're more probably over kind of 60%. Last year we had a revenue generated of about $17 million or about 140 million SEK. Yeah, next slide, please. So you can click. Yeah, that's fine. So just to explain a little bit the background, and if you understand the concept of image-guided therapies, so we deal with the human vessel structure. And our technology really builds a virtual twin or a copy of the human vessel tree. And based on that, in that we are incorporating a physics engine that is calculating the fluid dynamic of the pulsating heart and organs, and allowing physicians to introduce real clinical devices in the hardware we provide, but that then communicates to the software and provide a very realistic environment, initially for training, but these days more and more for planning and preparation to provide feedback to a doctor prior to doing the actual case on a live patient. Yeah, one click, please. Thank you. And the benefits of this is obviously this is a safe environment. It's a realistic environment away from patient. The only real alternative to this is to practice or rehearse on patients or potentially live animals, which is not really a good alternative for many reasons. And obviously you can provide a very structured training environment or a rehearsal environment. You can repeat this a number of times for the exact same feedback. It's cost effective, and it's obviously it's an effective way to save lives. All right, next slide, please. So to try to articulate what problems we're trying to solve, we can move to the next slide. So this is, I mean, in many cases, you're comparing to other high-risk industry, flight simulation or the aerospace arena is a logical way to start. You can look at multiple high-risk environments, other environments like space, like process industry, kind of nuclear industry, and so on. What you can see here is that people at the flight industry, they have moved through amazing development over the last 75 years or so, where the risk for a complication in the aerospace arena is nominal these days. It's less than 1 in 10 million, while the risk for a complication or an issue or a medical error, if you specifically in the healthcare arena, is more than 1 in 1,000. So that's the thing we're trying to address. Obviously, the medical space is much younger. It's very rapid development, and it's a lot of complications here, obviously. But I think it's clear that with today's technology, the old method of training on patients and training in the clinical environment is not really feasible anymore. It's not cost effective and not accepted for many reasons. All right, next slide. And this is just another way of looking at that. The situation here is given the rapid transition to minimal invasive treatment modalities like the image-guided therapies that we are dealing with, is obviously there is a lot of new technology coming in, and everyone needs to learn these new procedures, therapies, regardless if you are young in your position or if you've been a doctor or an expert for 20 years. So everyone needs to learn. It's also clear that in a lot of situations, there's a lot of complicated technology that comes together, and in many cases, the patient scenarios are fairly unique. So you need to learn to adopt for those different scenarios, and you need to understand that. And the learning curve here is quite substantial. In many cases, people talk, well, you talk about 50 patients learning curve or so. And obviously, we don't think that's acceptable to accept that learning curve is happening on patients. And again, this is not training in this space is not a training of a junior physician or a fellow restaurant or in Sweden, AT or ST. This is for experienced doctors that are going to do a new kind of procedure or use a new kind of clinical device. So if you look at many of these high stakes, high risk and complicated procedures, you can see that probably upwards to 50% of the procedures performed are performed by physicians that have not yet reached that proficiency level, which it's in no one's interest. Everyone obviously wants to be prepared for the task. So this is what we're trying to help to provide solutions for. Yeah, next slide, please. So clients here, I mentioned that briefly. On the left side is example hospital clients, 500 or so right now. Initially, was a lot of them were university clinics or teaching institutes, but more and more is going to general hospital systems. Fairly well distributed between North America, Europe, and Asia. Looking at Asia, we have a very rapid deployment or development in China. Japan is a very strong market for us as well. And we see good development in India, but we're also present in many other parts of Asia, obviously, and in Europe, really across entire Europe. Developing areas like Eastern Europe, Russia, and even South America is areas where we are also working with. Our biggest market is the medical device industry, where we have probably about 100 clients or so, and this is 60 or more, so between 60% to 70%, depending on year of our total business. And here we work with a majority of the large medical device companies. We work with them globally. I think we work with, or I know we work with all of the 10 largest medical device companies in the world, and they come to Mentice to get help with the launch of a new product. So they basically come to Mentice, can you implement our new device in your technology? Can you provide it with a training environment to safely roll this product out? So that's where we spend most of the time. Thank you. Next slide, please. A little bit about where we're heading. We can move to the next slide directly. So this is one example of one of our main growth opportunities. We work with the imaging companies like Siemens and Philips, GE, and others, Sony, and so forth, Canon. What we do here is that we have integrated our technology into their environment. So when these machines move around, you move the table, you move the X-ray camera here. The images are updated. The images you see in the screens are Mentice images. That would allow doctors and team to actually practice in a real environment. Again, the only other alternative would be to try to learn a new piece of equipment or a new procedure with an actual patient on the table. So we provide them with a virtual patient, and this is a massive opportunity. It's about 4,000 of these operational room or cath lab as they are called sold per year. And the current annual volume of Mentice system it's probably about 200. So we have a massive upside here if we can effectively bundle our technology together with these vendors. All right, next one, please. So we use the self-driving car technology as a comparison. So if you look at this represents some self-driving cars, and the current state of the automotive industry, we say it's somewhere around the 3 here. So the most advanced vehicles right now with the most recent Tesla or the new Audi or whatever are probably like a 3, where you can where the car can take own decisions, but you need to have a driver there, you need to have a steering wheel, you need to have pedals and so forth, so to allow the operator to take over. And then going all the way to the right, a 5 here would be basically a vehicle without the steering wheel or pedals, where the robots, if you may, would take completely over. Looking at the state of the medical field, I would say there's a 0. I mean, pretty much 0. Maybe in some areas we have the industry have made attempts to do 1, but in most cases it's there. So we believe there's a lot of opportunities here, and we believe Mentice have one part of that technology to help the medical device or the medical industry, to move up to 1 and 2 and 3. And we obviously the ultimate ambition is to get to robots that can fully autonomous make a procedure. But we believe that's going to take time. But I also think there is a lot of opportunities for everyone in the step 1 and 2 and 3 here, which is what we are dealing with. All right, next one, please. So this is another way to illustrate that. So we started some 20 years ago with just providing basic training solutions for primary skills, for basic skills for junior doctors and so. Moving over to the right to what we call proficiency, which is using benchmark, objective assessment, and data. It's still a much more effective way to train, but also to compare your skills. That would allow a doctor to go in and practice something, and then immediately compare his result to the mean of doctors doing that procedure. So that's obviously going to be a big part of what we do going forward as well. Moving over to what we call process, which is more team related, the interaction between people in a cath lab, but also the process of getting a patient from onset from an accident or from the hospital door into the operation. Where we focus a lot of our time on now is what we call precision and predictive. So precision is where we do patient-specific activities. So our technology allows for importing a CT scan or a computed tomography scan, and to make that into a 3D model. And that 3D model we can convert to a simulation environment, which would enable a doctor to actually rehearse on an actual patient's anatomy, maybe the same morning as he or she would do the case later the same day. That would allow a team or a doctor to understand maybe some of the difficulties they will run into, maybe discuss with colleagues on what approach or what devices to use, things like that. And we've seen already that could significantly reduce risk for a complication. They can significantly reduce procedure times. What we want to get to and already are working with, we have patent pending, is the predictive side, where we provide guidance. So here, again, comparing with the automotive industry, you can compare that to auto braking, line assist, adaptive speed control, things like that. So we believe there is a lot of opportunity for us with our physics engine and our technology to actually help doctors with those kind of advices on techniques to maneuver the device in a correct way, how to twist the device, or what device to use, and things like that. So this is what we're working on. This is what we're working on right now. So this is not a future dream of where we want to be in 5 years. This is what we're working on now. All right, next one, please. This is just, you can click to the 6 boxes there, so you can click on that. Yeah, thank you. So this is just some cornerstones or blocks on where I believe we are and where we want to go. So obviously we need to continue making sure that our core capability and core functionality are on the absolute state of the art, on the simulation and replicating the real environment. We're working with both the physical simulation using 3D printed anatomies and real devices, and also the virtual environment. So to make sure that those are synchronized, but also are up to the task and up to the realist that doctors need is important. The integration, as I talked about, into the imaging arena and the Angio suite with the imaging companies like Siemens and Philips is also super important, and we believe that's one of our biggest opportunities for the near future in terms of a path out to the market. Then the data and the data analytics around doctors and physicians and teams using our technology, but also combining that with results from actual cases is going to be very, very valuable. And with the ability in the simulation environment to actually track specifics of a case, understanding not how a case was performed on a high level, but also going down to the detail, understanding the exact step of the procedure, how much force that was applied, the order of events, what kind of errors were made, things like that, to be able to really provide very qualified feedback. That's also a very important part of our future. And obviously, we used to say we are following the money, following technology. What's important is that it's so rapid development and innovation in the field of image-guided therapies, and we need to be on top of that, and we need to be a couple of years, kind of before the curve. So we are constantly looking at what is happening in 1, 2, or 3 years in terms of procedures. How can we help the device companies to get kind of simulation environment for the products in an early stage? So that's also very, very important. And then we believe that the planning part or the precision medicine part of using our technology is going to be one of the largest opportunities going forward. So using actual patient anatomies and use our technology to prepare for a specific case, not just a generic case. And then obviously all of this is also leading to robotic support, and that could be part support, a robot acting as an assistant to the physician, or the other way around. Ultimately, we're going to autonomous intervention or autonomous procedure, but that might be some way out in the future. All right, next one, please. Yeah, we can click. I think it's, yeah, thank you. Oh, perfect. So our ambition, the last 3 slides now, our ambition here is to become the vendor of choice. I think we already are, but broader than just training and simulation for performance and outcome solutions in healthcare. Obviously, our target is for the next 5 years is to maintain or to stay in the image-guided arena. We have a very clear growth plan for the next future, which is really following our growth target defined. We believe that the majority of that growth will come organically, but we also have a very clear M&A track where we know that part of our growth will come from acquired businesses. We did 2 acquisitions last year and another one a couple of years back, and that's clearly an ambition for the next future here. Yeah. So quickly, I'm not going to spend a lot of time on this, but these are some of the tracks we're looking at in terms of object for M&A. So our key focus is the 2 leftmost boxes here with software solutions for image-guided therapies, really looking at AI machine learning related solutions. And the other one is related to the image companies, so the Siemens and Philips and similar companies solutions to really make our offering more complete. But as well here, AI machine learning robotics is really a key theme. This is something we have been working with actively for the last 6 to 9 months, and we hope it's going to result in something during the year here. All right, last slide. You can check next. Thank you. So the summary here, I'm just listing a couple of bullets. So the physician guidance and the analysis self-driving car is a leading theme for us. It's important. We believe a lot in that. The idea of using our tools to provide relevant feedback to physicians. The second point here, the component in an effective delivery of a cath lab equipment or cath lab environment. So really helping the imaging companies to be more effective in how a hospital can effectively use new technology, new functionality, be able to introduce a new therapy or a new clinical device. Number 3 here is the migration to robotics and remote mental services. Also very, very important, where we believe that the technology we have is a critical part of that. One of the most difficult part in terms of teaching a robot is to get data, test data. And one of the ability we have is obviously to use synthetic test data. We can bring in 10 cases or 100 cases from real patient, and then we can morph them into thousands of the cases. So our ability to create relevant test data is a really important part. Point 4 here is the value of data, the value of the performance data, the ability to look at the case and be able to dissect that case into details, into benchmarks, into metrics is really, really important to understand why did this case go wrong? How can I improve in the kind of performance of this group of doctors? And obviously, overall, the ambition to help improve the efficiency of care in this specific area. The last point, I think it's obvious. I mean, our technology needs to be on top. I mean, and be state of the art. And we know more and more people are now using our tools, which also put requirements on us in terms of ease of use, user interface, the ability to use on multiple platforms, things like that. Everything from smartphones to iPads, and so it's not only as we had 5 or 10 years ago, where we were running on a high-end laptop or even a desktop. So the environment is changing here. So that was what I had, Richard. Hope that gave you a brief overview of what we're trying to do here at Mentice.
My first question is, using the analogy of self-driving cars, can you please dive into a bit of how vascular twin can help surgery moving from very manual to more augmented and self-surgery, so to say?
Yeah, I mean, if you look at the details of a procedure, you're navigating 3 or 4 coaxial clinical devices, a wire and a catheter, a balloon, a device, whatever, in through the vessel, and the intermanipulation between these devices is very important for the ultimate case. So what we can also provide is guidance. We can track that behavior, and we can immediately warn the doctor if he's trying to maybe advance the catheter ahead of the wire, or he's trying to do, maybe he forgot a step in the procedure and things like that. So there's a lot of things we know in the logics. If we have captured how the ideal procedure should be done, we can help the doctor to exactly as in the car. Have you forgot to put your seat belt on? Or whatever. I mean, so these kind of assistance we can do.
Okay. So basically, taking this something one step further is basically if you were to drive a car on a track, you would provide the ultimate, well, where to brake, where to accelerate for the physician, so to say, in surgery.
Exactly.
Good. And my next question is, can you please describe the sales process that your imaging partners use when they sell your software and how the bundling process looks? How many of the end clients are accepting the software? How it's been received by the end clients or customers?
Yeah, we have obviously worked with this just for the last year or something like that, 12, 15 months or so, and I think we have placed somewhere between 25 and 30 systems to the end clients to Siemens and Philips. But what we see here is that a lot of clients obviously have requirement or an interest in getting a Mentice system in their cath lab environment in order for them to get access to training. But what Siemens and Philips see is that the ability to actually use a virtual patient rather than a real patient to understand how the new Philips and Siemens equipment works, or understand how you can use a new set of functionality on the new machine, is really something that helped Siemens and Philips to justify their new kind of solution. So that's what we see. But so far it's a fairly small volume. I mean, it's 10-50% of our overall sales. It's still not that much, but and obviously the pandemic during the last year and the beginning of this year have not helped. But we're hoping that will change or would change over the next year here.
Okay, fair enough. And if we look at robotical surgery, I've been looking at robotical surgery in other anatomies. And can you please elaborate a bit where the Corindus system is right now in terms of regulation and in terms of installed base compared to, let's say, more systems in other anatomies? So, for example, Intuitive Surgical's Da Vinci system.
Sure. I mean, the Corindus, Corindus is a subsidiary to Siemens, and they are one of a handful, I would say, 3 or 4 interventional or endovascular solutions on the market. So that the robotics solutions for endovascular or image-guided therapies is way behind the surgical side. Corindus have an approved device. I think they have placed about 100 systems in the market. Which I think compared to Intuitive, you know this better than I do, Erik, but I think there's about 5,000 robots sold to Intuitive clients. But I think the opportunity here is very nice for Corindus, but also their competitors, because there are a lot of things that could be done. I mean, the endovascular procedures are interesting in one way. It's not that many degrees of freedom. You are basically rotating and navigating clinical devices, so wires, catheter, and what have you. So I think that there is probably a faster path for these companies to go to more automated solutions. But where they are right now, they are using it for remotely guided cases. So what's possible to do is for a doctor in one site to operate the robot in another site and view for stroke cases, which is a typical situation where you don't have time to transport the patient. The patient need to get the treatment immediately, since every minute counts. And these robots and this technology is very useful because you can actually have a doctor dialing in remotely and access the robot and actually performing this procedure remotely. But they also use for PCIs or for heart infarcts or similar. So I think those are the two main areas.
Okay, interesting. And it's because I've looked quite a lot of the minimal invasive surgical robots, and it's for the same amount of that you see less force that you get a better recovery from doing it with this sort of robot, or is it just as you say that you can do it from a distance or remote?
No, I mean that's the first application with the remote services, and I think the argument here is to bring the physician out of the actual operating room, get the team and the physician away from the X-ray exposure, but also the ability to sit in a control room in a better chair, a better position. You don't have to wear lead. The doctors need to have lead to protect themselves from X-ray, which doesn't help the maneuverability of the doctor, obviously. So I think the tactile feel and the ability to be more precise is also a factor. But I think more and more, what everyone is expecting and looking for is when the robot actually starts becoming a robot and not just a gearbox or whatever you call it, where the robot actually can help making decisions and help maneuvering the devices or doing part of the job. And I don't think that's so far away. I think the autonomous procedure we talked about is probably quite some time away. But I think there's a lot of things that can be done in much more near term.
Thanks. And then I have one question from the web, and it's about your market share and your competition. Who would you say is your main competitor, and who do you work to gain more market share?
We basically opening up a market. We are creating the market. We are the only vendor that solely focus on the image-guided therapy area and the interventional area, aka the endovascular area. So when we look at competitors, there are other simulation companies called like 3D Systems. They have a division called Symbionics. It's a Canadian flight simulation company called CAE. But they are a broad-based training and broad-based simulation company. So they are operating on all areas, all disciplines. So when we have one product area, they have 6, 7, 8 different product areas. So both these companies are larger overall, but they probably less than half. The largest competitors to us is less than half than we are in the kind of vascular space. But again, for us to go from where we are to where we want to be, it's about us opening up new markets. It's not really to take market share.
Okay, so it's more about expanding the total addressable market rather than gaining market share. Okay, I think we have time for one more question, and that is one for me. And can you please describe your 2 latest acquisitions and how they fit into the journey towards more autonomous surgery?
Yeah. The first one is a New York-based company called Vascular Simulations, and they deal with I referred to that in the presentation, physical simulation. So that's a company that really have a technology to allow you to print silicon coated or the 3D model that you silicon coat. And then you actually run procedures with these models and anatomy models, and that's used mainly in the medical device development process and in very advanced cases. And we did that because we see the complement to the virtual simulation that we do, and we want really to be a one-stop shop for both medical device companies, but also hospital in terms of provide you the solution that makes sense for each step of that process. So we believe that could help us get much earlier in the development process for new clinical devices. That was a fairly small company, but we believe that's going to probably be around 10% of our revenue for this year, maybe even slightly more. So very relevant, but very good response from the market. A lot of our clients have an interest in using both physical and virtual modeling or virtual simulation. The other one is a smaller company, more of a technology acquisition, where we acquired a data or a cloud-based solution to capture clinical cases. So an environment where doctors really record their cases is sort of a resume for doctors. So when they apply for a new job or when they need to be certified for doing a certain procedure, they need to demonstrate how many cases they have done of a certain kind. They need to have some sort of report on the quality of the work done. So we provide that solution, and the idea here is to integrate that into our cloud set of solutions where we provide to all of our clients. Yeah. That's it.
Thank you, Göran. Thank you for your time for dialing up to Erik Penser Bank and our Imaging Day. Thanks.
A pleasure. Thank you.